Hello, thank you for tuning in to the Minnesota Department of Health Stroke Coordinator 101 training. This training is developed and presented by Stroke Coordinator Jen Wells Pittman and MDH Stroke Program. This training is broken up into 3 modules. Module 1 is all about stroke coordinator roles and responsibilities. Module 2 discusses certification and designation. And Module 3 covers quality improvement. Upon completion of all 3 of these modules, you can access a link in the video description at the end of Module 3 to complete a survey for 1.0 contact hours. Please also reach out to the Minnesota Department of Health if you come across any issues throughout reviewing these trainings and with any and all of your questions. Thank you so much for all that you do and enjoy this training series to support you in your stroke coordinator role. I'll now turn it over to Jen Wells Pittman. Thank you.
So Module 1 is going to be about the stroke coordinator role and responsibilities, and this is Module 1 of 3. The objectives is we're going to kind of describe some of the role and responsibilities of the stroke coordinator related to stroke coordinator tasks, program management, and data analysis. And each of the subsequent modules will go through some more of this in depth. So this is kind of an example of a day in the life of a stroke coordinator and things that people might be working on. So the stroke coordinator is responsible for planning, implementing, and coordinating services and activities associated with the stroke program. So this might be establishing and monitoring clinical performance criteria, assuring compliance with stroke center regulatory requirements, establishing effective treatment plans for selected patients, the utilization of discharge planning techniques to enhance movement of patients to appropriate levels of care, staff education, and direction. The stroke coordinator will demonstrate a commitment to ongoing personal and professional growth through internal and external learning opportunities. You may also see various different stroke coordinator job descriptions, so this may be a good place to start if you do not have one for your site. So when you think about the day in the life of a stroke coordinator, every day is going to be different. So you'll be looking at finding a routine that works for you and your program based on your patient volumes, the FTE dedicated, the support staff you have, gaps in your program, where you are in your review or designation cycle. And here are some kind of examples of things that a stroke coordinator may be looking at. So we may be looking at current inpatients and providing direct feedback to providers and RNs caring for those patients, reviewing new emergency department patients, looking at our intervention patients who may have gotten IV thrombolytic or maybe going for thrombectomy, looking at our transfers and how quickly we're getting transfers in and out, any patient events that have come up, complications, or things that we might be looking at as well. Stroke coordinators are also maybe looking at monthly, quarterly, annual data reviews and performance improvement planning, and really using some of that data to drive your practice and looking for your gaps within that. Following up with area needs. So if you've rolled something out in a new area, or if you know that you've got different areas that have different needs, you might be following up with them. Developing and tracking staff education, and we'll talk a little bit about that here in a minute. A big part of the stroke coordinator role is also looking at new standards, clinical practice guidelines, the literature, and determining how to implement best practice into your areas. You might be doing agendas and minutes for stroke group meetings and multidisciplinary meetings related to your stroke program, maybe going on patient rounds or multidisciplinary rounds, either daily or occasionally, to know what's going on with different patients and how the team is functioning. And then also having a lot of meetings related to stroke projects, institutional initiatives that may impact stroke, and your stroke program. So really kind of looking at your program as a whole through all the different levels and areas that your patients go through. So when we look at staff education, each accrediting body, whether you're doing accreditation through the Minnesota Department of Health, the Joint Commission, DNV, they're all going to have different requirements for staff education. So we would really want to look at that. Who needs education? How often is that? Are there requirements for what they're educated on? And making sure that we are kind of tracking that and making sure that we are ensuring that everyone has received that education. So you really want to develop a staff education tool to really ensure that you aren't missing anyone. This can be also submitted with your certification sometimes as well, and really helps to kind of direct what you need to work on when, give you some time frames, identify those educational needs and target the education to those. Also looking at when you're developing your education, do you have a lot of data defects in certain areas that you want to reinforce? Are there gaps that you want to reinforce? Reinforcing new practice changes. So making sure that the educational needs fit the population. So if you're educating your emergency department RNs, you're going to be looking at those processes versus if you're implementing education with inpatient nurses, you're going to be looking more at inpatient care. Making sure that staff and providers have orientation to stroke within their orientation. We really want to make sure that we are hitting these staff up right when they start and getting them up on board with the stroke needs right away. So I'll show you a staff education tracking example on the next slide. My recommendation would be to at least update it minimally twice a year. So you want to update it at the beginning of the year with your plan. So really talking to the areas, figuring out who needs education, what the plan is, what needs to be developed. Are you doing in-person education, a module? Are you doing mock codes or something else to educate the staff? And then you also want to at least update it at the end of the year with what was actually completed. And I would recommend doing this more in October or November. So if something was missed, you still have time to complete it to meet your goal. You want to make sure that you have your education contacts up to date. So if you have specific contacts in different areas that you work with, making sure those are kept up to date in case someone switches positions. And then if you're able to record any of the live presentations, that's super helpful so that people who weren't able to attend can still watch it and get that credit. Another good suggestion is to collaborate across your healthcare system to prevent duplication of efforts. So if you have other acute stroke ready hospitals, primary centers, comprehensive in your healthcare system to collaborate, and maybe you can share some of those education modules and presentations with each other. So this is an example of a tracking tool. This is just an Excel document. So listing out the area and role on the left. So if we're looking at our emergency department, we might need to educate our RNs, our providers, our pharmacists, and then thinking about, can they have one education for all of them, or are we doing very role specific education for each? And then listing out your area contact person. So you could link in their emails or phone numbers in here as well. Having a column for what orientation they are currently doing. Their yearly education or whatever you're doing each year. So in 2024, for the EDRNs, maybe we're doing a physician presented on stroke pathways and pathology. And then they also did an online learning caring for the ED stroke patient. And then for 2025, maybe we're looking at doing mock codes and the same online module as the year before, but we've updated with new practices and things that we need to reinforce. So kind of keeping an ongoing list of what you're doing each year for each area, and then having a note thing so that you have notes of where things are at. This is super helpful when you're working through each month to figure out what I need to do next to keep notes on where things are at and who has fully completed their items. And then obviously this could get quite lengthy depending on what areas you need to educate and what roles. Another tool that's helpful for stroke coordinators is to complete a gap analysis. So this is really helpful to identify gaps in your practice and where you may not be meeting the standards. This is also a really good idea for new stroke coordinators because it helps you really learn what the standards are for your institution and for your level of certification and your certifying body, because it's really important to understand what the standards are while you're working on different projects and getting ready for your visits. For any of this, I'll show a gap analysis example on the next slide. I find using color coding is really helpful to clearly, quickly see which things are already being met and which things need to be worked on. And then making notes of things that need to be updated, remove things when you're completed, link to your online documents. So if you already have a repository or somewhere online that you are storing all of your documents for your staff to have access to, you can put the links in your gap analysis as well. And really making it as thorough as possible so that in the event that you have a visit or something where people need to be able to speak to it, that they can look at the gap analysis and be able to pull up the appropriate documents and resources to be able to speak to those. So what I like to do each year is I go pick the document that has all your standards or requirements, and then putting it into a spreadsheet or some type of Word document where you can kind of track things. So this is a gap analysis example of a non-real accrediting body, which is some standards listed in here just as an example. So like standard 1.1a might be that the program has a plan for multiple stroke activations occurring at one time. And this is pretty common for the primary and comprehensive centers to have a document for this. It's very helpful for acute stroke ready as well. So then you want to make sure that you're linking in your resource or policy addressing this. So if I know that we have a plan in place, I'm going to link it here, highlight it green, and kind of just let that one sit there. The next one might be about education and educating all employees on stroke identification and response. So for this year, maybe I did an online MERT module that went out to all staff about identification and response and just told them what they need to do if they see someone with new signs and symptoms. So I'm going to link that there. I might put the course ID or however I'm going to label that in there as well so that it's easy to find. And then maybe the next one is about reviewing data with upper leadership. And maybe I've found that we aren't currently doing that with our program. And so I need to figure out which upper leadership group is appropriate to share this with. How am I going to share it with? So I'm going to kind of put those comments in my box about what I need to do. So I might meet with my stroke director. We might review the data and decide that it should go to a specific upper committee, or maybe it just needs to be emailed to upper leadership once a year for approval of your ongoing review plan. So really talking about that, keeping kind of a list of what you're working on and then keeping it red. And then once you've completed that and you have a plan, then switching it to green and moving on to another one that needs to be worked on. So the color coding just kind of helps give you a quick overview of where you need to kind of focus some efforts right away when you're doing this. Occasionally then your accrediting body, whether that's the Department of Health, Joint Commission, DNV, they're going to update their standards. So you want to make sure that you're reviewing those, updating your document, making sure that you're meeting the new standards accordingly when those are released as well. You might want to start thinking about how you're going to track your stroke patients. And we'll talk about this a little bit more in some of the data module. So you might be looking at how you're tracking your stroke code activations from the emergency department and how you're tracking your inpatient strokes. This is super helpful for providing feedback, looking for trends, modifying things based on gaps, citations, needs, and that you want to make sure that you're sharing that data with your areas as well. So here's a couple examples of things you might use. There's a number of tools you can use to do this, which we'll talk about in the data presentation. But looking at if you have inpatients, what are things that you want to be monitoring? How are you going to do that? And are you going to do it in real time? So you may have a spreadsheet that you put your new patients when they're admitted, and then you might be putting in there, if it's an ICH, did they have their ICH score done within 6 hours? And so you'd put information in there about that. For ischemics, did they get their antithrombotic? Did they get a statin? Has VTE been instituted? What does your stroke education look like? So if you're tracking the patients in real time, you're able to give feedback to the providers and staff caring for those patients to make sure they're getting the best care possible. For your ED stroke alert activation, you want to have some type of method to collect data on your ED activations. Here are some of the things that you may consider thinking about collecting. So arrival date and time is super important. What time did the first physician assessment occur? What time did your NIST occur? The CT order, start and interpret time. Did they have any advanced imaging? Was there thrombectomy, or not thrombectomy, tenecteplase or alteplase decision? What time was that administered? The transfer decision, if you needed to transfer the patient, and your door in and door out time. So these are just a couple examples. If you start thinking about your IV thrombolytic time, and let's say that your goal is 45 and you really can't get it past the 50 mark, then you can look at this data individually and try and figure out where the longer times are. So is it between the order of the CT to the start time? What's the delay between there? Are we having delays from the time the patient arrives till the physician gets there? Is there a big delay between I've decided I'm giving IV thrombolytic and now I'm administering it? And maybe you're looking at where you're storing it or something to decrease that time. So the data is important to help you kind of help direct some of the things you might be doing with your program. You also want to make sure that you're tracking all of your stroke related projects. So typically it's super helpful to meet with your team at the beginning of each year, kind of determine your initial goals for the year, what new things are coming, and obviously that's going to change throughout as well. So keep a list of your projects and the status of those and the contacts and where things are at. Share those updates with your stroke work group or your stroke team regularly so that people are aware of them. It's also super helpful if you have team members that can also present on it instead of you having to present all of it. So if you have a team that's meeting that's multidisciplinary and maybe you've got a project going on in your emergency department about your IV thrombolytic times, maybe someone from your emergency department can present the data and information on that. And then if you have something with radiology, maybe they can present their information on that as well, so that it's really a team effort. And then I think it's super helpful too to keep a list of your yearly accomplishments so that at the end of the year you can really see where you've come and how much you've gotten done. And that's also one thing that's really helpful to share with your upper leadership as well, along with your data, is here's our data and here's all the things that our program has accomplished this year. One of the best things that you can do as a stroke coordinator is really increase your networking. So that's going to really help you be more successful in your role. It's going to help give you more support and give you resources as well. So if you're part of a healthcare system that has other stroke coordinators, that would be the best place to start. So if you're sending your patients to a primary center or a comprehensive center, really connect with those stroke coordinators. Or do you have other coordinators that are in similar roles in your institution? So we know a lot of places there's a single stroke coordinator, you're a party of one, and it can be kind of lonely and kind of hard to get started. So if you have other coordinators in similar roles, it's super helpful to connect with them. So do you have a trauma coordinator or a cancer coordinator? Some places have bariatric coordinators. To connect with those people in similar roles. Even if you're hitting a roadblock with a project, a lot of times they can be like, oh, I had a project that was similar and this is what I did to overcome that. So really network with those people. Consider meeting with any of these people on a scheduled basis, especially when you're first starting. It's super helpful. If you are part of a healthcare system that does have other stroke coordinators, so let's say you've got 3 acute stroke ready sites and a primary site. If you can assist each other with your on-site visits, I found that to be really beneficial. You learn a lot being at someone else's visit and then also being able to help support that stroke coordinator during their visit as well. You could also start collaborating on your education, any citations or opportunities that you have, sharing resources, and really building up a kind of a community of coordination between your sites. When we look at orientation and the transition for a new stroke coordinator, sometimes that can be very difficult, especially if you are the only person working in that stroke role in your healthcare system. So really setting that program up for success with sustainability and succession planning, really having a detailed orientation plan. So if you're new to the role, you kind of know where you're starting and what to move through. And also if you're rotating out of your role, to think about helping start an orientation plan for the next person of what's helpful, who they need to meet with, what resources they need so that they can be successful as well. Considering appropriate preceptors. So I know a lot of systems will kind of connect them with another stroke coordinator or another coordinator in that role. Sometimes they'll connect you with a nurse manager or someone in the emergency department or on one of the inpatient care units to kind of guide you as well. And then do you have any opportunities to shadow? So if you are sending your patients to another health system that's outside of yours or within yours, are you able to go and shadow for a couple days and really learn from other stroke coordinators who have been in their role longer? So I will turn it back over to Michelle.
Super. Thank you, Jen. So to close up this section, our first module on the stroke coordinator role and responsibilities, we have put a couple of our key websites for the Minnesota Department of Health stroke program. So if you're looking for further tools and resources to support you in your role, please visit our web pages. You can also please feel free to contact the MDH stroke program directly at any time. Thank you for tuning into Module 1 of the Minnesota Department of Health Stroke Coordinator 101 training. As a reminder, upon completion of all 3 training modules, you can access a link in the video description to complete a survey for 1.0 contact hours. Please reach out to the Minnesota Department of Health Stroke Program with any and all questions. Thanks for all you do and enjoy the training series to support you in your role.